Stevens-Johnson syndrome. Stevens-Johnson syndrome and toxic epidermal necrosis, SJS/10, are very serious skin peeling conditions that are caused by an allergic reaction to medications or an illness. Hospitalized treatment includes stopping the problem medication, replacing electrolytes, applying skin dressings, and providing pain medications and antibiotics. What is Stevens-Johnson syndrome (SJS)? Stevens-Johnson syndrome, SJS, and toxic epidermal necrosis, 10, are serious skin conditions that cause your skin to develop rashes, blisters, and then peel. Your mucous membranes, including your eyes, genitalia, and mouth, are also affected. If you get this condition, you'll likely be admitted to a hospital. Some people consider SJS and 10 to be different diseases, while others consider them to be the same disease but at different levels of severity. SJS is less intense than 10. For instance, skin peeling might affect less than 10% of the entire body in SJS, while skin peeling affects more than 30% of the body in TEN. However, both conditions can be life-threatening. Are there other names for Stevens-Johnson syndrome (SJS)? Yes. It is also known as Lyell's syndrome, Stevens-Johnson syndrome, toxic epidermal necrolysis, and Stevens-Johnson syndrome, toxic epidermal necrolysis spectrum. It might be called drug-induced Stevens-Johnson syndrome or mycoplasma-induced Stevens-Johnson syndrome if it's linked to a specific cause. Who gets Stevens-Johnson syndrome (SJS)? Many cases of SJS happen in children and adults younger than 30 years old, but also occur in others, especially the elderly. More cases of SJS occur in females than males. Infections like pneumonia are the most likely cause of SJS in children, whereas medications are the most likely cause of SJS/10 in adults. Who gets Stevens-Johnson syndrome (SJS)? Many cases of SJS happen in children and adults younger than 30 years old, but also occur in others, especially the elderly. More cases of SJS occur in females than males. Infections like pneumonia are the most likely cause of SJS in children, whereas medications are the most likely cause of SJS/10 in adults. What are the risk factors for developing Stevens-Johnson syndrome? A combination of factors is likely involved in developing these disorders, including a genetic bias. Environmental factors might cause the gene to be triggered. One of these genetic factors includes specific human leukocyte antigens, PLAs, that may increase one's risk of developing SJS or 10. Symptoms and causes. What are the symptoms of Stevens-Johnson syndrome (SJS)? Symptoms of Stevens-Johnson syndrome include skin pain, fever, body aches, red rash or red blotches on your skin, cough, blisters and sores on the skin and on mucous membranes of the mouth, throat, eyes, genitals, and anus, peeling skin, drooling, because closing the mouth is painful, eyes sealed shut, due to blisters and swelling, painful urination due to blistered mucous membranes. What causes Stevens-Johnson syndrome (SJS)? Causes of Stevens-Johnson syndrome include allergic reaction to a medication, most cases of SJS and almost all cases of 10. Infections like mycoplasma pneumonia, herpes, and hepatitis A. Vaccinations. Graft versus host disease. No known cause. If your case of SJS is caused by a drug, symptoms appear about 1 to 3 weeks after you start taking medication. The flu-like illness, fever, cough, and headache, skin pain, is followed first by a rash and then peeling. In the case of 10, some people even lose hair and nails. What drugs are most likely to cause Stevens-Johnson syndrome? Medications most likely to cause Stevens-Johnson syndrome include antibacterial, sulfa drugs, anti-epileptic drugs including phenytoin, dilantin registered sign, carbamazepine, Tegretol registered sign, lamotrigine, lamictal registered sign, and phenobarbital, luminol registered sign, allopurinol, alloprom registered sign, xyloprom registered sign, a drug used to treat gout and kidney stones. Non-steroidal anti-inflammatory drugs, NSAIDs, including piroxicam, Feldon registered sign, nevirapine, Veramune registered sign, and diclofenac, Cambia registered sign, Flector registered sign. Antibiotics. Are there other factors that increase the risk of someone developing Stevens-Johnson syndrome (SJS)? You are at greater risk of SJS if you have the following conditions: bone marrow transplant, systemic lupus erythematosus, human immunodeficiency virus (HIV), other chronic diseases of joints and connective tissue, cancer, weakened immune system, family history of SJS, variation of a specific gene called human leukocyte antigen B. Recovery can take months if symptoms are severe. Some long-term reactions may develop, including skin, dryness, itching, change in skin color, eyes, chronic swelling and/or dryness, chronic irritation, difficulty seeing, sensitivity to light, photophobia, excessive sweating, lung damage, chronic obstructive pulmonary disease, asthma, nail loss or deformity, hair loss, alopecia, dryness of mucous membranes, which could cause problems urinating, chronic fatigue syndrome, difficulties with your sense of taste. SJS may redevelop if you are exposed to the same medication known to have triggered the condition the first time. In such cases, the second episode is usually more severe than the first episode. SJS results in death in 10% of patients and in 30% for those with 10, due mostly to sepsis,